Hello, I'm Elaine Flint and I'm the VOSCA representative to the Health and Wellbeing Board, as well as Chief Exec at Wellspring Healthy Living Centre. So I've been to a number of meetings as a VOSCA advocate to do with Health and Wellbeing Board. The board itself took place in April, and one of the key things it's working on at the moment is a refresh of the Health and Wellbeing strategy for Bristol. So they took basically the criteria to the board, but the main works are being done in a small steering group, of which I'm there as the VCS representative, or if I'm not there, then Sue Brazendale from VOSCA takes my place, and Ellen Devine from Healthwatch is also there, as well as officers. The key thing they're looking at is deciding on the criteria for what should be in the strategy. They very much want to strip it down from the last one, which was sort of all-encompassing, absolutely everything. They feel they want to be looking at areas where there's evidence of need and potential impact, and where it's clearly issues that the partnership around the Health and Wellbeing Board can have an impact on, and where the Health and Wellbeing Board is sort of the right body to take a lead on it, so that which seem quite sensible criteria really. And also the move is very much to narrow things down to a number of key priorities in this refresh. At the moment it looks like the key priorities and areas of work are going to be mental wellbeing and social isolation, healthy weight, and alcohol misuse. Now this is still work in progress, and looking at those things with sort of cross-cutting themes of prevention and early intervention, innovation, inequalities, and then the wider determinants of health. So that's the sort of process that it's looking at in terms of the refresh of the strategy. So for those of you who were involved in the first strategy, that was just sort of massive, and this is about saying let's pare it down to something which can be really held by the board, and there can be action plans that they're in charge of. So I personally think it's a better way of working, and hopefully will provide more of the focus for the work of the board, as well as the legal stuff that has to go through in terms of commissioning. So next steps is that there'll be a workshop, a board workshop around the strategy refresh on the 2nd of June, which will be a working group looking at these priorities. Are they the right ones? How to take it forward? What's the knowledge base? And then that will then go to the June Health and Wellbeing Board, I think on the 22nd. So that's the sort of process that there is, and it will come out then later. I'll see if I can find the time. So between June and September, they're talking about sort of wider stakeholder engagement around this new strategy. So that will hopefully be a time when the sector can get involved. So that was really the main thing. Other key areas we was talking about at the board was there was an update on the alcohol misuse strategy, and there's going to be a second summit in July 2016. There was one last year where they've got some work streams that officers are working along, and this again will fit into the health and wellbeing strategy refresh. There was an item around the Home Improvement Agency commissioning. Now this is a service that is currently provided by We Care and Repair, who actually provide 16,000 client interventions a year, which is rather wow, isn't it? And what they're saying is that they'll actually let that contract run for an additional 18 months so that they can align it with the community equipment contract, and then go out together for those two contracts, you know, to make the best value. So hopefully that's relatively good news for West of England Care and Repair. There was an update on Better Care Bristol, delivered by Mike Hennessy. There was a paper which was around the activities, update activities for 16-17. I compared it with some previous papers, and I was rather concerned to see that social prescribing had actually dropped off it. So I challenged that, and I was told that that was absolutely not the case, and that it was widely supported by officers. And in fact there was an informal seminar after the formal meeting, and there was a lot of discussion on social prescribing and its role for the future of health and social care. So that's one to keep an eye on. The other one to keep an eye on around Better Care Bristol is something called the Community Webs Pilot. Now this is an opportunity to tender which hasn't gone to the voluntary sector. It's gone purely to GP surgeries. And GP surgery has been asked to look together, how they can come together into groupings of about 20,000 patients and apply to be able to work with their community. What that looks like, I don't know. I know from here that Wellspring Surgery, together with Montpellier and Lawrence Hill, have put in a bid for community web. I've no idea what other interest there is around Bristol, or what it will transpire in terms of actual activity. I think it's only sort of like one post or something per web, but that will be coming out. And then lastly, there was a presentation around integrated personal commissioning programme, which is around bringing together personal health budgets, social care personal budgets and health personal budgets. Really small numbers in Bristol at present. I think only 16 in Bristol with personal health budgets at present, but they aim to extend in this financial year to children and young people, and also to people with learning difficulties. So that's the sort of direction of travel. So those were the main things, and then that was followed by an informal seminar, which was really looking at how the board could work better. Everybody was feeling it was far too bogged down in just seeing commissioning papers, and maybe there was a way of having half of it talking strategically and around how to move the strategy forward once it's agreed, and maybe half of it then reduced for the commissioning decisions. So I think there's a real move to try and change it to be more effective, which I think I would completely support. So I think that's it from this report.